Kenya enjoy the highest attainable standards of health. This constitutional mandate bestowed on us by the Constitution challenges us to find ways of developing an accessible, affordable, and effective national healthcare system that delivers the best preventive as well as curative services. As government, we have made a commitment to the people of Kenya that we shall harness the post-pandemic recovery momentum to make significant progress in reversing and minimizing the burden of non-communicable diseases, especially cancer, heart diseases, and diabetes-related complications. Additionally, we are acutely aware of the drastic socioeconomic impact of these diseases. Many Kenyan households live under the threat of having all their savings wiped out by illness, and 36% of Kenyans risk falling into poverty on account of catastrophic financial expenditure. Our commitment under the universal health coverage pillar of our bottom-up economic transformation agenda consists of a well-considered intervention to ensure that we fulfill our obligation to deliver the best possible level of medical treatment and healthcare services affordably, efficiently, and in an inclusive manner. As has been articulated by CS for Health, I have taken long hours, many hours, with my team at the health department to figure out how we are going to do this together with our counties to ensure that this time round we get it right. We have attempted universal health coverage twice, and we have not succeeded. I have told my team this time there is no chance for us to fail. We do not have the luxury to fail. And that is why we are having a paradigm shift on matters health. While we support the entire ecosystem of curative health, we have to reimagine and focus our attention this time round on preventive and promotive interventions as a way of minimizing cost and arresting situations at the earliest possible opportunity. To succeed in this commitment, we are deeply conscious of the fact that health is a devolved function requiring us to employ consultative and collaborative mechanisms of intergovernmental cooperation and partnership with due regard to the evolving role of donors and other stakeholders. Access and quality are the most salient concerns in considering the ways and means of delivering healthcare to Kenyans. For this reason, it is extremely important for us to sustain the momentum in which we have expanded the infrastructure to house various categories of health facilities and equip them with the equipment and technologies required. It is also important to accompany this development program with interventions to radically bring down the cost of treatment to a level where it is no longer a barrier to access for the majority of Kenyans. And I agree with the comments made by the chair of this great institution that we have waiting lists running into months for access to chemotherapy, for access to linear machines in our various institutions. At the moment, we only have 3 linear machines in public hospitals, 1 in this great institution, 1 in Kenyatta, and 1 in Moi Teaching and Referral Hospital. I want to say that going into the future, I have also received requests for a linear machine in Nakuru, Mombasa, and Garissa. And now I have also gotten a request that you have an extra bunker in this facility. I want to commit to you, as I do to the other 3 hospitals in Nakuru, Mombasa, and Garissa, that these LINAC machines will be delivered in the next 120 days. The Ministry of Health is properly guided on the mechanism for the delivery of these machines, and I agree that we should reduce the time Kenyans have to wait for treatment from months to days. Hopefully, with the delivery of these 3 machines, Kenyans will have to wait for hours. Hopefully. I am really hoping that that is the direction we want us to go. Any additional equipment that will be required, we are going to have a conversation. We have already agreed with the ministry on how we are going to deliver on the critical equipment that are required for the proper